everyone! Thank you for coming on the call today, and welcome to this webinar on essential oils for use in labor. My name is Stephanie Pearson. Some of you may know me as administrator of the Facebook group Essential Oils for the Birth Kit, or because you've taken my online training course of the same name. So I continue to add to this body of knowledge, both from connecting with professionals and getting some anecdotal evidence through their stories, through my own experiences, and also continuing to keep up on the research. Currently, an estimated 15.2% of pregnant women use self-prescribed essential oils during their pregnancies. This is from an Australian study, but I hope that we can continue to work together to grow this number. It is required by law to work within the scope of practice. So if a health concern that I talk about falls outside of your level of training, or is not within your scope of practice, please do not use essential oils for the treatment of a symptom or medical condition fitting that description. I want to be really clear that when I reference pain or back labor pain, those references describe the normal pain associated with natural childbearing, not an unusual pain that could indicate a medical condition. So it's important to make that distinction that we really are working with normal, healthy symptoms of labor and that time period. To begin, here are some basic safety tips for use during labor. These guidelines that I'll be sharing are intended for use in healthy, unmedicated labor on individuals who have given their consent. We can use essential oils safely during medicated labor, but it does not fall within the scope of this presentation to go over those guidelines. It's a good idea to avoid ears, eyes, and other internal uses, and avoid contact once the baby's born with the mom's chest, for example. So if the baby's eye is going to be laid on the mom's chest, you want to be careful that the chest has been wiped clean or the oils have had plenty of time to be absorbed. Test oils on the skin before use. I usually dilute them to the recommended dilution and then apply them to the wrist and look at them for 12 to 24 hours. You can do this before labor begins. Do not use essential oils in a birth tub. A labor tub is a totally appropriate, wonderful way to use the oils. I'll explain in more detail later why I prefer that to using them in a birth tub. Follow directions for use and use therapeutic quality essential oils. A few more words on quality. I have some bullet points listed there, knocking off some of the main criteria for choosing high quality oils so that you can look through that and see which things are important to look for. I won't read through these because they're also on my website. I just want to point out that quality is an important consideration for both safety and effectiveness. The oils I use and are referring to in this presentation are therapeutic quality. So the reason for this is that most oils, in fact, as much as 90% of the essential oils sold in the United States as pure essential oils are actually fragrance grade, diluted, or otherwise adulterated. The FDA has determined that a product only needs to contain 5% of the ingredient on the label to be called pure. So in other words, most essential oils are produced for scent, not for therapy. So even if it says pure lavender, pure organic lavender essential oil, we don't know for sure that there's not 95% synthetic lavender in addition to that 5% pure organic lavender. So many of these are just created for scent. They're not created to use in a clinical setting like we're talking about today. Actually, in order to create a really high quality oil that's used for its full therapeutic benefit, each step of the process and its growth has to be considered. So from sourcing to growing to processing, the company doing the work would need to take extra care to ensure that all the vital natural constituents remain active. So some plants have as many as 200 different therapeutic constituents, and if the processing cuts corners or at any step you're cutting corners, you're going to miss out on some of those constituents. The best companies will also undergo at least 7 tests for purity and potency before making the oils available to the consumers, and these tests should be done by a third party and should be accessible to you. One of the defining attributes of essential oils is that they're penetrating. This is one of the reasons they're so effective and that they're so different from herbs or even allopathic, over-the-counter types of wellness care. Essential oils actually cross through cell membranes and through sometimes even the blood-brain barrier. They can cross the placenta. So we want to make sure that when we're using oils that can penetrate us so deeply that they are pure. So here is just a little bit more information. This is a study done between pure jasmine and synthetic jasmine, and they used these oils aromatically, and they tested the response of the participants in the study. And it was pretty interesting because the impure jasmine causes sympathetic response, like elevated heart rate and other symptoms of sympathetic excess. And the pure jasmine created more parasympathetic reaction. So molecularly, they're not equivalent. And I just bring up this point because even after studying herbs for as many years as I did, when I first got into essential oils, I thought, oh, okay, I can see topically or internally why you would want high quality oils, but aromatically, does it really matter? And yes, it does. It has a different effect on your nervous system. We know that for sure, and I'm sure other things are affected as well. So also there you can see that the National Academy of Science said that 95% of the chemicals used in synthetic fragrances are derived from petroleum, and this includes benzene derivatives, aldehydes, many other known toxins and synthesizers capable of causing cancer, birth defects, central nervous system disorders, and allergic reaction. So please don't take these recommendations and use your grocery store adulterated lavender when you use them. So here is a chart. I wanted to include this because for a lot of people, essential oils may seem like old news, but we have modern access to high-tech processing now and also testing equipment, and they're helping us to create higher quality oils and have this traditional practice available to a whole new level, which is making it wildly popular. So I thought I would throw in this chart to illustrate how the improvement in quality coupled with funding and interest in doing research are growing the potential for use of essential oils in healthcare. And this chart just tracks the number of studies done since 1944. And you can see how much they've increased, and they're going to continue to increase dramatically. So it's my best intention to keep up to date on this and provide this information to you all. I very, very much value the collaboration with others who are working with oils during pregnancy, whether you're a mom using them in your own pregnancy or a practitioner. I think we can communicate and work together to grow our knowledge and research base, particularly with regard to birth. So I encourage all of you to share this value, to post your experiences with essential oils to the Facebook group. So I really am investing in community here. Rewriting my handouts and re-recording the modules for my e-course to include new anecdotal and scientific evidence based on what we're learning. There are some primary applications to consider for use during labor, and we really are going to stay very focused just on labor during this presentation. And the two I'm going to focus on are aromatic and topical. The third one is internal, and I don't use oils internally during labor. So I'm going to stick with topical and aromatic. And it's good to just know and consider from the beginning that various metabolisms, also methods of application, levels of sensitivity, all of these very individual things create variables in how much oils we need and what concentrations to use. So as a rule of thumb, it's a good idea to start with the lowest dose and increase incrementally as needed. Watch for reactions, even though they're very rare. So this is a good rule of thumb, and when I'm giving you concentrations later in the class, just know that's sort of the starting amount. If you're working with an individual who's highly sensitive and tends to react to a lot of things, you would maybe want to adapt them to be not quite that strong, but for most people, they won't have a problem starting with that starting amount. And if they're not working, then it's probably because you need to increase the amount, or maybe you're using the wrong oils. But what I've seen is that these do work very well.
Hi listeners, this is Stephanie McBride, and unfortunately when I was looking at this to publish, I noticed that the recording stopped definitely in the very beginning of this webinar, which was a live presentation. I thought it would be worthwhile to go ahead and include what's here since it does have some good tips on safety and application and dosing during labor. There's a lot more information you can find on my website on this topic and other birth-related topics, and I also work with individuals who are my customers for wholesale therapeutic quality oils through doTERRA, and have free training programs for them, and also non-product related continuing education training for midwives and birth professionals. So there's lots of great information. I also have a new book out on the topic, and I do work with groups of people to plan webinars and things like that, and also travel quite a bit to teach. So if you'd like to learn more and contact me or check out some of my other resources, you can use my website, and hope you have a great day. Sorry about the cutoff for the webinar. Take care.